Hello and welcome to today's webinar. My name is Joseph Krieger. I'm the president of Boston BioLife. And today we're very pleased to have Dr. Alan Bauman with us. Dr. Bauman is the founder and chief medical officer of the Bauman Medical Hair Transplant and Hair Loss Treatment Center in the Boca Raton, Florida area. The hair hospital, which he manages, is a 12,000 square foot standalone facility designed for state-of-the-art hair restoration technologies. Dr. Bauman received his medical degree from New York Medical College, and his surgical residency was done at Mount Sinai Medical Center. He's worked at the Beth Israel Medical Center in New York, and he's one of only 200 physicians working worldwide to achieve the certification of the esteemed American Board of Hair Restoration Surgery. Dr. Bauman is known for pioneering numerous technologies in the field of hair restoration, which he'll be discussing today. And these include follicular unit extraction, low laser technologies, PRP, and other biologics, as well as new and emerging technologies. He's currently running live surgical workshops and training programs in the area of hair restoration using myriad of technologies from nutrition to scalp health and other areas that really can facilitate a patient's ability to achieve a positive outcome and have a good result from their hair loss experience. So, Dr. Bauman, thank you very much for being here with us today. We appreciate you spending time with us. And as always, we look forward to your presentation.
Hey, thanks, Joe, for that great introduction. Again, I'm Dr. Alan Bauman, board-certified hair restoration physician, coming to you from Boca Raton, Florida. And today we're going to talk about hair loss 2020, the effective medical management of androgenetic alopecia. And that's what I've dedicated my entire professional career to. And we have a lot of fun doing it, helping people look good and feel great. So if you do want to learn a little bit more about my background, I encourage you to check out the website. So we're just going to jump in today and get going with what we do here at what I would consider the hair hospital. And that's located right here in Boca Raton, Florida. And this gives you a nice overview of how we treat hair loss today. So here at the practice at Bauman Medical, we do everything from hair transplantation and, of course, bioregenerative medicine for hair regrowth like PRP. Of course, a lot of different education and training programs, and you'll learn a little bit more about how to get into the field of hair restoration and how to help your hair loss patients as we go along today. And we'll talk a little bit more about some other educational opportunities as well towards the end of our presentation. But I wanted to give you a more general overview because not only are we doing transplantation and these bioregenerative treatments, but also managing the hair loss process. And that's what we'll focus on today, as well as scalp health. We do a lot of research and consulting for businesses large and small around the country and around the world. And we also do non-surgical hair restoration. So patients who are not candidates for hair transplants can use 3D printed cranial prosthetics or hair and scalp prosthetics as well. So pretty interesting stuff here at Bauman Medical. We encourage you to check us out a little bit further if you do have some interest there. Today, we're going to talk a little bit about hair and self-image, of course, the physiology of the hair follicle, hair and scalp health, and an overview on hair restoration treatments and procedures, and then a little bit about next steps. And of course, you can always send me some questions at any time if you have a question about hair loss or hair restoration or anything that's related to those fields. So for the millennia, hair has been a sign of beauty and youth. And maybe this was the first Facebook post, I don't know, but she seems to be checking him out, although he does have a little bald spot there in the crown. But a lot of our friends have told me that beauty and youth should also be accompanied by fertility when it comes to hair. And it's no question that hair is a sign of that for the ages. And when you look good and you also feel good too. But we also know that hair loss affects a lot of people here in the United States. Probably close to 100 million Americans are suffering from hair loss, about 50 million men and about 30 million women. And so there's a lot of issues going along with the hair loss process because when it happens to you, it makes you feel bad. You can have fear and anxiety. You can have an impact to your self-esteem and self-confidence. Feel older, less attractive. Many of my patients, especially guys in their younger ages, will avoid social situations or wear a baseball cap to hide their hair loss. And in this day and age, gosh, the internet is packed with information, a lot of misinformation actually, about hair loss and hair restoration, and this can delay treatment. And so patients will doctor shop, they'll search for miracle cures and so forth, even run around to their local physicians, derms, OBGYNs, primary care physicians, anti-aging docs and get batteries and batteries of blood tests to no avail, and really without any effective treatments. So we really want to get a handle on what we can do about the hair loss process. And it all starts with really the coolest organ in the body, right? Which is the hair follicle. The pilosebaceous unit, as you can see right here, has a lot of components to it. And that's what makes it such an interesting organ, not just for research. It's got certainly a very, very active metabolic profile, but also you can see the circulation and attachment to nerve endings, its proximity to fatty tissue, as well as its own oil gland, and now we know its own sweat gland, its own muscle. Erection occurs obviously at the level of the hair follicle. So it's a pretty complicated little organ that we've got there. And what I always say is that it's a highly accessible dermal appendage, which is a musculo-neurovascular endocrine mini organ containing a stem cell niche capable of degeneration and regeneration, which altogether can elicit a significant emotional response in the owner or the observer. And so for hair fiber production to occur of these 100 to 150,000 scalp follicles that you have right there on your head, what we know is that 84% of them are in a growing phase at any given time, and they're going to produce about a half an inch to a quarter of an inch of hair every month. So that's a lot. About 1,600 inches a day, or about 6 feet of hair per hour, is made at the level of the scalp. And you know, it takes a lot of energy to do that. If you try to create a gram of hair, which is about the amount of hair that would fit into, like, say, a sweet and low packet, you'd have to do over 10 minutes of vigorous exercise to burn the same amount of energy. So your body commits a lot of energy to making hair, and maybe that's why it's so important in terms of its impact on how we look and how we feel. So if you're not sure what the follicles look like under the scalp, here's a strip of scalp with the hair follicles embedded, and you can see the base of those follicles, the root of the follicle, the dermal papilla, which is embedded deep within the fatty tissue, the fatty layer. And that does tell us a lot maybe about the interaction between fat cells and those types of stem cells and the hair follicle perhaps. But we all know hair follicles turn on and turn off over time. And so the anagen, which is the growth phase, is followed by a degeneration phase of catagen and telogen, and then that cycle continues on and on and on over time. As that cycle continues, what I want you to be aware of is that the hair follicle will be producing hair typically for about 2 to 6 years at a time, and then about a 90-day resting phase before it kicks in and grows again. And unfortunately, this can trigger a shed in between the cycle, and so which can also trigger quite a bit of panic, obviously, in a patient who's experiencing it. But 100 to 200 hairs is basically normal. And I've given you this little video here. I hope you can see it, that shows a little bit about really the activity and action that's going on under the scalp at any given time, hair follicles turning on and turning off and so forth. Because sometimes when we look at our scalp, it looks kind of static. But this chronobiology, or this hair follicle cycling, is really under tight control. And we know a lot today about these cycles and what controls them. So there's really two centers within the cell that communicate, or two centers within the hair follicle that communicate between themselves. The bulge of stem cells, which is located about a third of the way down the hair follicle, close to where the erector pili muscle attaches, and the proliferating progenitor cells of the dermal papilla, which is at the base. And so these two cell populations communicate back and forth to control the anagen, catagen, and telogen, or the growth and resting phase, the alternating phases of hair growth over time. And this is very, very tightly controlled cell signaling. This image may look like a alphabet soup if you're not familiar with the different growth factors that are related to hair growth. But the interesting thing is that we know a lot now about these different growth factors and how they turn the follicle on and off, kind of like a chemical switch. And we want to be able to hack the follicle. We want to be able to turn the follicle on when we want it to grow thicker, stronger, healthier hair. And a lot of our treatments and therapies are designed to really get into this hair follicle cycling so that we can turn a follicle on and keep it on. The other thing that I want to tell you is that the hair follicle stem cell niche is not just the follicle itself, the bulge and the papilla, but also the surrounding dermal fibroblasts and the adipocytes, and they all play a role. And to take this analogy a little bit further, in order to grow good quality hair and have healthy hair follicles, of course, we want the soil of that forest to be super duper healthy. And we know today that scalp health is a major concern for many, many people out there. If anybody knows what the most popular shampoo is in the world, I'm going to give you a little hint. I'm going to tell you it's Head and Shoulders. And so can you imagine over 100 bottles a minute, or almost 39 million bottles a year of Head and Shoulders is being sold? And why is that happening? It's because people occasionally, probably 50% of people out there, have irritated, inflamed scalps. And so it's not a good environment for healthy hair growth. We want to try to address that, certainly. And here's just some photos that you can see of an unhealthy scalp and the inflammation that kind of goes along with it. This can be accompanied by symptoms like itching, flaking, oily, or even dryness. And we want to try to impact that if we're going to grow good quality hair. A lot of the data and a lot of the research now has kind of been directed at this multifactorial pathophysiology of hair loss, which includes some intrinsic assaults on the hair follicle, for example, like stress and so forth, as well as inflammation that could be happening in and around the area of the hair follicle, as well as environmental assaults, things that we apply from the outside. So as I mentioned before, hair follicle chronobiology is a very tightly regulated process, and inflammation can interrupt this. Repeated exposure to inflammation can actually shut the follicle down permanently, and so we definitely want to try to interrupt any kind of inflammation that's occurring. Damage to the hair follicles can be temporary or can be permanent. We have to interrupt any kind of insult to the follicle at the earliest possible stage. And so, again, a strong concept. There are all of these different insults to the hair follicle which interrupt the cycling. Everything from the natural aging process to heredity, or response to different hormones, our response to cortisol and stress, diet, nutrition, to you name it, things that are happening from the outside like pollution, products and styling and such, which can really shut the follicle down, literally pushing more follicles out of the growing phase and into a resting phase. And that's not good for a healthy head of hair. Just some symptoms here on scalp health. We've got, as I mentioned before, itchy, oily, dry scalp, as well as coarse hair thinning, hair breakage, down to sores and scaling and crusts on the scalp are important signs of poor scalp health. And as I mentioned before, some of the internal factors and external factors, which I would typically go into more detail in some of our more robust training classes like the Hair Coach program that we do here at Bauman Medical. But taking a quick step back, male pattern hair loss, androgenetic alopecia is the most common thing that we treat here at Bauman Medical. 98% of all hair loss is genetic, and we know that it's visible from across the room. If you're a guy, you can see it happening, receding hairline over time and then extending into the crown. And we know that DHT, dihydrotestosterone, which is a derivative of your own natural testosterone, is that trigger which causes the hair follicles to miniaturize over time. And that's important because the mainstay of therapy could be something to block either the conversion of testosterone to DHT or the effects of the DHT. Now, in women, it's a little bit more complicated. I'm going to touch on just a few things here. Genetics and heredity obviously play an important role in women, as well as illness and diet and nutrition, stress, hormones, surgery, scalp health, and of course this inflammation that I mentioned before. But we get a different type of pattern in women. We don't often see as much of a hairline change as we do a depletion of density, a diffuse loss of hair quality and quantity, typically in that frontal zone just behind the hairline. Sometimes we can see a receding temple area as well. Other types of hair loss in women that we see in the practice, telogen effluvium, like excessive shedding, as well as traction alopecia, often caused by different hairstyles, braiding, pulling on hair, like from extensions, and then some of the more scarring types of alopecia, like frontal fibrosing and cicatricial, are a little bit outside of the scope of our presentation today, but we do teach that in our training classes. So here's what the female hair loss scale looks like. What I want to bring to your attention is that we can see that 50% of the hair you can lose 50% of the hair before it's noticeable to the naked eye. So even before you get halfway through this scale, you can lose over half of your hair. That's not such a good thing. So 50% of hair loss in that middle zone. If you're looking with the microscope, however, you can see that happening a little bit more clearly. And so these are some of the photos that we take with the dermoscope or hair cam right in a clinic situation here in the office, where we can see those miniaturizing hairs in both men and women, those hair cycles that are being affected, so less density, less caliber hair. And we know why that's occurring. We're trying to figure out, is it the genetics, is it medications, illness, stress, and so forth that's causing those weaker, thinner, wispier hairs over time. And then taking a stab at what are the different types of treatment strategies? What could we do? What are the tools in the toolbox that we would typically use to address the hair loss situation? Of course, it starts with the medical history first and goes along from there. So trying to identify and quantify what those triggers and the risk factors are, taking a look at someone's medical conditions, medications, lifestyle, and so forth, identifying those and trying to reduce those triggers or risk factors in a patient is an important part of treating a hair loss situation. Again, taking a look at the scalp health, we can do that with a variety of different tools and techniques, and then correct that scalp health problem with different approaches such as scalp treatments, or what we call the scalp makeover, even simple changes in hair care regimen, decreasing inflammation, for example, or other issues at the level of the scalp. Decreasing androgen effects, certainly important in men and certain women. We can use pharmaceutical and nutraceutical approaches to do that. Increasing hair follicle function, this is probably the area which we've seen the most improvements over the past few years, trying to address hair follicle function not only with chemicals and pharmaceuticals, but also with nutraceuticals and organics, laser light or red light therapy, regenerative medicine techniques like PRP and PDO grow, the use of bioengineered or recombinant growth factors, stem cell therapy, you name it. But of course, if the follicles are dead and gone, we're going to need to redistribute permanent follicles into those depleted areas. And of course, that's what a hair transplant does, removing hair follicles that are resistant to the hair loss process from the back and the sides of the scalp, and implanting them literally as little as one at a time into the thinning or the balding area using an artistic approach. A quick overview of some of the hair loss risk factors. I'm not going to spend a lot of time on this, but we all know, as I mentioned before, poor scalp health, smoking, as well as exposure to general anesthesia, even high fever and viruses and such can affect hair follicle cycling over time. And this long list of medications, from blood pressure, cholesterol, anxiety, depression, to birth control and thyroid medications and hormone replacement in men and women, can also trigger these effects in the hair follicle. Looking more closely at scalp health and trichology, we have ways to examine the scalp using a variety of different scientific methods, such as scalp pH level, moisture level, sebum level, looking with the microscope under blue light and white light microscopy to identify oxidized sebum, and really getting a complete picture of the health of the scalp non-invasively, and then performing maybe a scalp makeover, which is a diagnostic and therapeutic treatment regimen that delivers treatments dependent upon what we found during that examination, and optimizing really the health of the scalp. So scalp makeover is a do good, feel great treatment. You can see here the improvements in the scalp, but it also feels good, feels very relaxing when you have that kind of a treatment done. We have different devices now that are available to help us accomplish this. The hydrofacial and Keravive system is great. You can hear it and see it working right here, right on the scalp, to exfoliate as well as to deliver different proteins and peptides, for example. On these two different patients, male and female patients, the hydrodermabrasion technique is exceptionally good, as I said, to deliver different peptides and proteins as well as to exfoliate. Of course, over time, we want to track the hair loss situation, so we'll do a baseline measurement with the hair check trichometer. This is a non-invasive way to get literally measurement of exactly what's happening at the level of the scalp over a course of time. And this is something that we teach at our hair coach program, certainly, and you get actually the kit, a starter kit, which has the hair check device, and you would learn how to use this tool hands-on. And here you can see a way that we would describe and depict hair mass index changes for our patients over time, which can track the response to treatments and also encourage them to maybe be a little bit more compliant with therapy, and also determine, if you're doing some kind of an intervention like a PRP treatment, when would you do the next treatment, because we know that those therapies don't last forever, the effects don't last forever. Digging deeper into treatment strategies, we know a lot about how laser light therapy, nutritionals, and these other types of medications and growth factors work. And so, again, these would be more reviewed in more detail in our treatment and training programs. But as an example, low-level laser light therapy is something that can be used at home. This is a non-chemical, non-invasive treatment. Here, this slide is featuring the newest, latest, and greatest turbo laser cap, which is the most powerful, most portable, and fastest treatment time of all physician-prescribed laser therapy devices for hair regrowth, and it is FDA cleared for that. And here you can see some examples of a patient who had some regrowth over the course of a year with laser light therapy. Nutrition and nutraceuticals is something that we also focus in on, teach and train. Aside from just providing the follicle with good nutrition, obviously we can address the levels of cortisol, inflammation, as well as hormone levels with nutraceutical intervention, and even getting down into the microbiome of the gut and the skin using different probiotics these days, very powerful. Both Viviscal and Nutrafol have some very good peer-reviewed journal articles which support their use in terms of density, diameter, and so forth. And we would review some of those during the Hair Coach program and recommend those routinely to our patients. In terms of pharmaceutical intervention, what you'll see is that we're typically prescribing now not the over-the-counter Rogaine anymore in terms of topical minoxidil, but we would use a compounded minoxidil. It's going to be a lot more gentle on the skin, but powerful on the follicle. It's not going to be a greasy or gooey mixture. And this is something patients would typically use twice a day. So we teach how to instruct our patients to use it correctly and how to get good results with that. Here you can see some before and afters after some periods of time. Usually visible results with these kinds of therapies take at least 6 to 12 months. If you don't remember, the double-blind, randomized, cleverly crossover study performed on finasteride from years ago. That's the oral anti-DHT medication. You can see it here where they showed a very strong dose-dependent result from oral finasteride. We do prescribe that a lot in our male patients as well as in our postmenopausal female patients. We would review the chance of sexual side effects as well as the positive effects from oral finasteride in our patients. You can see here a nice response from oral finasteride in this patient before and after 10 months. Because of the concern of sexual side effects with finasteride orally, we sought out a compounder to create a topical finasteride product, and this is called finasteride or formula 82F, I should say, which contains finasteride also and minoxidil. And so it has a very positive effect on hair growth, has a low serum concentration of finasteride when it's being used, and much lower risk of side effects. Not as effective as an oral treatment, but again, a great option to avoid the sexual side effects. If you're concerned about those with the oral medication, you can use this topical. Some of the magic happens, however, though, when you combine these therapies. Patients always want to know what happens if I use this plus that. So here you see some examples of topical medications plus red light therapy, formula 82M minoxidil plus laser. You can see this in these women who are in their 50 years and older. Very powerful effects, non-surgically, obviously. Just medication and laser light therapy alone, with or without nutraceuticals. And so these 3 different women, very impressive effects from a combination of non-invasive treatments. Sometimes you can see the results happening at 3 months. Sometimes it takes a little bit longer. One of the latest and greatest regenerative medicine technologies I'm sure you have already heard about is PRP, platelet-rich plasma. And so that's what we dive into next. We do hands-on training for PRP, really using a bespoke methodology of dual spin process along with the signals and scaffolding to really get a very powerful hair regenerative effect. Of course, as we know, platelets are the workhorse of regenerative medicine used in tissue repair, wound healing, as well as skin rejuvenation, dentistry, spine surgery. Gosh, you name it. There's so many different areas of medicine that are leveraging the growth factors within the platelets. And today we know exactly what those growth factors are doing at the level of the scalp and how they increase proliferation, differentiation, and survival at the level of the hair follicle, and prevent really the apoptosis or cell death that occurs at the level of the dermal papilla. We also know what the correct dose is, or at least we think we know the nice dose relationship between the number of platelets that you can concentrate with these spin procedures and the effect at the level of the scalp or the skin. And here you can see there's a direct relationship between platelet concentration and mesenchymal stem cell migration and proliferation, as well as new blood vessel formation. So 1.5 million platelets per microliter, that would be our target dose of platelets when we do a dual spin process in the office. And those of you who've heard me speak before know that I can go on and on about our dual spin procedure. And I think it's one of the major breakthroughs that we've learned, really what gets a strong effect at the level of the scalp. So PRP for hair loss is an autologous therapy. It uses a patient's own platelet-derived growth factors as an outpatient procedure over a lunch hour. It's a comfortable, low-risk process. We know how it works, and our results are very well documented. And this is an example here of one of our PRP classes. We're teaching and training how we apply, not only how we create the PRP, but how we apply it correctly. And so spinning the blood down, obviously, with a dual spin process through centrifugation. To get to that 1.5 or more million platelets per microliter, this is how we test it right there at the bedside using a Coulter counter. You can see the baseline platelet count at about 250,000, which is normal, and then our platelet count, which is 1.6 million platelets per microliter. And so what's in your PRP? If you don't know, if you're not getting good quality results with PRP currently in the scalp, then maybe we should be looking at this kind of dosing strategy for the PRP. And these are some of the results that we're getting in patients who are good candidates for the process. So both male patients with some early stage thinning can get some reversal within the year, usually between 6 and 12 months. We're seeing some nice improvements in hair quality and quantity. And in our female patients with that widening part line, the thinning and miniaturization in that frontal zone, also in the early stages, can get some great results. We've also seen some interesting results in patients with traction alopecia, where the follicles are still alive, not dead and gone, using PRP in these areas where they've either had damage from braiding or the application of wigs or weaves and such, or even hair extensions. Now, interestingly, in this day and age, a lot of patients have not been able to come into the office due to social distancing and or stay-at-home orders. And so we've developed a new procedure called virtual PRP that they can do at home, utilizing the same combination of different types of treatments that we would use in the office, basically leveraging growth factors and cytokines in an at-home therapy that was through recombinant cell culture conditioned media technology, which I'll mention again in a moment, as well as some nutraceuticals and laser light therapy combination for at-home use. And we do teach how to apply this process in our hair coach program, and you would have access to this combination of therapies for your patients should you decide to learn a little bit more about it. If you're not familiar with the way that this technology works, you need a source of mesenchymal stem cells in the laboratory. So the cell culture is expanded and conditioned in a particular way to get a separation of cells and then a secretion or a secretome product. And then that secretome is then collected and essentially bottled, sterilized and such if need be, and then sent out to physicians to provide to their patients. And so our virtual PRP, our at-home kit, would include laser light therapy, microneedling device like the dermal stamp, as you see here, a liquid stem cell stimulator, which is the growth factors and cytokines, in addition to a stem cell support nutraceutical, which has a lot of good peer-reviewed research behind it. And so this came out of a clinical trial that we did using these growth factors and microneedling in the office, and I'll just show you a couple of results here before and after 16 weeks of treatment using this kind of therapy. You can see a rejuvenation of color and quantity of hair in this patient, a 55-year-old female, getting some nice improvements, as well as in some of our male patients. We had about 12 patients in the original clinical trial. Interesting results all the way through, which we would also can present to you during the hair coach program. We also obviously have the access to the different types of patient information formats, like the videos that tell you how to use these treatments at home. Diving into my favorite form of hair restoration, we're going to talk a little bit about hair transplant surgery. Of course, no presentation from Dr. Baumann is ever complete without a little chit chat on hair transplants. And of course, what we're doing today is not pluggy or painful anymore. It's not going to result in a long linear scar. We don't do it that way anymore. This is the minimally invasive approach of hair transplant surgery, where we're going to take the individual follicles or grafts one at a time from the back of the scalp using a very tiny instrument, usually a 0.8 millimeter rotational tool. And you can see here kind of what the follicles, what the grafts look like, containing sorted here 1, 2, 3, or 4 hairs each in the petri dish there. Here's an up close view of what these follicles look like when they've been extracted from the body. You can see the nice intact structure of the follicular unit, the groups of 1s, 2s, and 3s. And if you look close, you can even see some of the sebaceous glands that come in along with it there as we do the harvesting. Of course, the best thing about this kind of harvesting is it doesn't leave any linear scar tissue. We're only taking a small amount of hair follicles from the back of the scalp at any given time. And so here's a patient 24 hours and 14 days out from the procedure. They can return back to normal, if you will, without a bizarre looking hairstyle. And of course, his results here before and 12 months out from the procedure, you can see the hair regrowth in a natural pattern that gives nice coverage to the scalp, not overstated, wispy, wavy hairline design using artistry and this follicular unit technology. So follicular unit micrografts really is the workhorse of the procedure. We use large sessions of these to create an artistic and natural hairline, and the angle, the orientation and position of these follicles are critical in order to get the end result, which looks soft and natural. It's a process by which we can recreate density for both male and female patients. About 50% of our patients are women coming through the door these days. And if you notice on the lower right-hand side, sometimes the hair has less to do with what's going on top of the scalp and more to do with what's going on between the lips sometimes. But as I said, when you start to look good, you feel great, and that's the benefit of hair restoration surgery and hair regrowth treatments in general. Here's some more examples of our patients going through the process and regrowing their hair. On the lower left, you'll see this gentleman is about 6 months out from the procedure, getting a little peach fuzz action going on there, and of course, growing all the way through the 1-year result. Now you're looking on the right-hand side, the restoration of the frame of the face. It's a local news anchor who had a procedure done with us. And patients of younger age as well, great candidates for hair transplant surgery. You see a patient like this in his mid-20s, hiding under a baseball cap, trying to get stabilized with medical therapy, then ready for transplantation. And you see the changes there, not only in the hairline, but also here in the temporal point as well. Important to see the improvements and how that changes up the frame of the face. And in female hairline design, women's hair loss can affect the hairline in many ways, shapes, and forms. Women's hairlines have many more variations, and so we can create things like increased temporal density, widow's peak if need be, or not for our female patients. A lot of women do come in want a lower hairline. So you'll see here on the upper left-hand side, a woman 24 hours out from the procedure and then a year after with the regrowth in the lower hairline. And on the upper right, you'll see here eyelash transplantation after severe scarring from an injury or accident that we did through our pro bono programs. And on the lower portion of this slide, sideburn restoration after facelift surgery. Very common request here in South Florida because the sideburns are typically ignored, removed, discarded, destroyed by plastic surgeons here and everywhere else. So putting that hair back is important to get a natural look and also to hide the scar tissue. Female patients can do very well, as I mentioned before, with hair transplant surgery. This is after 2 separate sessions of transplants for this young lady here. And for those of you who may know my history, the first person that I met who had severe hair loss was my dad. And you can see his results here from bare to hair after 4 sessions of hair transplant surgery, approximately just under 9,000 grafts. We did his procedure a number of years back, and so of course I'm proud of his result, and so is he. Although he's a little bit more gray these days, he's still got what looks like a good, thick, full, healthy head of hair there. So moving on from the hair transplant surgery, many physicians, I should say, want to know what's next. Well, patients and physicians, they want to know what is the latest and greatest, what's going to happen with stem cells, and can we regrow an unlimited supply of hair potentially for our patients? And I can say, well, it's a definite maybe. We don't know yet, but we're getting closer. So I'll introduce you to Nico, the nude mouse on the left over here. He's born and raised in Japan, and he's got increased self-esteem and self-confidence because he's got a bunch of new living and growing hair from stem cell therapy on the back of his nape of his neck over there. And so he's the envy of all nude mice in his portion of the lab there in Japan. But on a serious note, we are doing this kind of research right here in this country, here in the US. A friend of mine, Alexei Tursky, down in near San Diego, California, has been working with induced pluripotential stem cell therapy to try to grow dermal papilla cells combined with epithelial cells, as well as the use of a biological scaffold to create what you see there is a couple of new hairs. And that is the first step in a long journey to create an unlimited supply of hair for balding patients. So long way to go, but he's got a couple of first steps under his belt. So pretty exciting stuff. Congrats to the guys over there in San Diego. They're doing great, and they're going to keep us posted on this amazing technology, and certainly we'll keep all of you posted. But when it comes to treating hair loss, kind of taking a bird's eye view now, it's all about collaboration, and this is what we teach and train. And we've really developed a very profound network here of not only physicians and trichologists, but also cosmetologists and estheticians, everyone from the hair replacement industry to manufacturers and pharmaceutical companies to medical device manufacturers and so forth are really working together to try to help those patients who are struggling with hair loss. And this is something that I encourage you to become a part of. And the best way to become a part of that is to start helping hair loss patients in your own practice, or get better at it if you would like, and to learn from us here at the Bauman PRP class. And so you are now hereby I'm personally inviting you to Boca Raton, Florida, to join us either in person or also, to some degree virtually as well at BaumanPRPclass.com. And so what can you learn from us here at Bauman Medical and our class? Well, you're going to be able to expand your hair loss knowledge and help your patients grow better hair, protect the hair they have, restore the hair they've lost. You will get the hair check kit, which is the measurement tool and device. You'll get hands-on training on how to use that to ensure patient compliance. You'll learn everything we know now about regenerative medicine and hair restoration. So that would include hands-on with PRP and PDO, using the procedures and processes that I've developed over decades and thousands of patients, really distilled down for your observation and learning right here in the clinic. Learn about scalp health and the scalp makeover parts of trichology. What do we do to optimize the health of the scalp so that we can be better at getting those hair follicles to do their business and grow a thicker, stronger, healthier hair? You'll have exclusive access to prescription and non-prescription products, and you get a starter kit as well. You'll get access to our proven medical hair loss clinic program. So that's really the business side of things, how to run the hair loss vertical within your practice. And we, have a person who is a dedicated liaison to help you with that. And of course, you'll be a certified hair coach when you complete the program. So I encourage you to check out Bauman PRP Class for more information on that, BaumanPRPclass.com. If you want to text Boston BioLife to the number on your screen there, 561-220-2628, you'll get access to this presentation and more if you do text us that way, or you can just email haircoach@baumanmedical.com. And so I look forward to seeing you and hearing from you. And if you would, again, like to ask any questions at all, you can text that number, 561-220-2628 at any time to get a copy of the presentation or to get your questions answered. And I hope this was valuable, at least a nice introduction to hair loss and hair restoration here in 2020. And look forward to seeing you all soon. Thanks so much for your attention today.
Dr. Bauman, thank you very much. That was a wonderful presentation. I think it was great how you were able to incorporate all the different facets of hair restoration and scalp health, but also it correlates to translational medicine and other clinical areas where people see the importance of inflammatory diseases on the biochemistry. In particular, I thought it was great how you showed the follicle life cycles and how those were influenced by growth factors and other inflammatory mediators. And people understanding, physicians understanding how the science of the hair technology restoration works, I think is very important because they're able to translate that to their patients. And I see also that you have technology that's patient centric, where the patients can take preventative or maintenance related activities. This is bringing together the state of the art of different sciences, from mechanical tools as well as imaging equipment, lasers and topicals, in direct correlation with, in conjunction with, traditional regenerative medicine technologies like PRP. So the key thing I think you said at one point was, this is artistry. and how do physicians use their guile, if you will, to solve a problem, by using all these tools, much like an artist paints a picture, So I thought you did a great job at that, and then letting them understand that these are all the available things you can do, and here's the outcomes, and here's the different ways that it can be implemented, from patients
Yeah,
helping themselves to people go heavy duty on the science.
sure.
Thank you very much for spending the time to walk us through that.